In the realm of infectious diseases, influenza or flu and COVID-19 often find themselves in the same sentence. Both are respiratory illnesses caused by distinct viruses, sharing some common symptoms, yet possessing crucial differences. These differences are not just medical nuances, they dictate how we protect ourselves and others. Understanding these distinctions empowers us to make informed decisions about our health. It guides us in seeking appropriate medical care, adhering to recommended treatments, and adopting preventive measures. By distinguishing between flu and COVID-19, we contribute to a healthier future for ourselves and our communities. Remember, knowledge is the first step towards effective prevention and treatment. Let's delve into the specifics of each illness to understand them better. Influenza, commonly known as the flu, is a respiratory illness caused by influenza viruses. These viruses primarily attack the nose, throat, and lungs, leading to a range of uncomfortable symptoms. Flu viruses spread easily from person to person, primarily through respiratory droplets released when an infected individual coughs or sneezes. These droplets can land in the mouths or noses of people nearby or possibly be inhaled into the lungs. The flu typically announces itself with a sudden onset of symptoms. These can include fever, cough, sore throat, muscle aches, fatigue, headache, and congestion. While most people recover from the flu within a week or two, some may develop complications, particularly young children, older adults, and those with underlying health conditions. COVID-19, short for coronavirus disease 2019, is caused by the SARS-CoV-2 virus. This novel coronavirus took the world by storm in late 2019 and continues to pose a significant global health challenge. Like the flu, COVID-19 primarily spreads through respiratory droplets released when an infected person coughs, sneezes, talks, or breathes. These droplets can infect others in close proximity, especially in enclosed, poorly ventilated spaces. COVID-19 symptoms can range from mild to severe and may appear 2 to 14 days after exposure to the virus. Common symptoms include fever, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, nausea, vomiting, and diarrhea. It's important to note that COVID-19 can lead to serious complications, including pneumonia, acute respiratory distress syndrome, and multi-organ failure. While flu and COVID-19 share several common symptoms, such as fever, cough, fatigue, and body aches, some key differences can help distinguish between the two. One notable difference is the loss of taste or smell, which is more common with COVID-19. While some people with the flu may experience a diminished sense of taste or smell, it's not as prevalent as with COVID-19. Another difference lies in the onset of symptoms. Flu symptoms typically appear suddenly within 1 to 4 days of infection. On the other hand, COVID-19 symptoms tend to develop gradually with a wider range of possible symptoms. It's important to remember that symptom presentation can vary significantly from person to person, and relying solely on symptoms to differentiate between flu and COVID-19 is unreliable. If you experience any symptoms suggestive of either illness, seeking testing and medical advice is crucial for accurate diagnosis and appropriate management. Section 5, Diagnosis Dilemma Identifying Flu and COVID-19. Accurately diagnosing flu and COVID-19 is crucial for guiding treatment decisions, implementing appropriate isolation measures, and understanding the spread of these viruses. However, distinguishing between the two based solely on symptoms can be challenging due to their overlap. Laboratory testing remains the gold standard for diagnosing both illnesses. Several types of tests are available, including molecular tests, also known as PCR tests. These tests detect the virus's genetic material and are highly accurate in diagnosing both flu and COVID-19. PCR tests are typically performed on a nasal swab or saliva sample. Antigen tests or rapid tests. These tests detect specific proteins from the virus and provide rapid results. While faster than PCR tests, antigen tests may be less accurate. Antibody tests. These tests detect antibodies produced by the body in response to infection. Antibody tests are not used to diagnose active infection but can indicate past exposure to the virus. Your healthcare provider will determine the most appropriate test based on your symptoms, exposure risk, and the prevalence of flu and COVID-19 in your community. Section 6, treatment tactics, managing flu and COVID-19. Treatment for both flu and COVID-19 focuses on relieving symptoms, supporting the body's immune response and preventing complications. For mild cases, home care measures are often sufficient. These include rest. Give your body the energy it needs to fight the infection. Hydration. Drink plenty of fluids to prevent dehydration. Over-the-counter medications. Acetaminophen or ibuprofen can help reduce fever and alleviate aches and pains. Antiviral medications are available for both flu and COVID-19. These medications can shorten the duration of illness and reduce the severity of symptoms, particularly when initiated early in the course of infection. In severe cases, hospitalization may be necessary to provide respiratory support, intravenous fluids, and other supportive care. Section 7, prevention is key, safeguarding against flu and COVID-19. Preventing the spread of flu and COVID-19 relies on a multifaceted approach, combining individual actions with public health measures. Vaccination remains the most effective way to prevent severe illness, hospitalization, and death from both viruses. Annual flu vaccination is recommended for everyone 6 months of age and older. COVID-19 vaccines are safe, effective, and readily available for individuals 5 years of age and older. In addition to vaccination, practicing everyday preventive actions can significantly reduce the spread of respiratory viruses. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public places. Respiratory etiquette. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Physical distancing. Maintain a safe distance from others, especially in crowded or poorly ventilated spaces. Stay home. When sick, if you're feeling unwell, stay home to prevent spreading the virus to others. Section 8. When to seek help, recognizing warning signs. While most people with flu or COVID-19 experience mild illness and can recover at home, it's crucial to recognize warning signs that may indicate a need for prompt medical attention. Seek immediate medical care if you experience any of the following: difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion, inability to wake up or stay awake, bluish lips or face. For children, seek medical care immediately if your child has fast breathing or trouble breathing, has bluish lips or face, has ribs pulling in with each breath, has chest pain, is dehydrated, not peeing, no tears when crying, dry mouth, is not interacting normally, or is too sleepy to wake up. Early recognition and prompt medical intervention can significantly improve outcomes for individuals with severe flu or COVID-19. Section 9. Staying informed, staying healthy. In the ever-evolving landscape of infectious diseases, staying informed is paramount. Reliable sources of information, such as the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, provide up-to-date guidelines, recommendations, and insights into the latest developments regarding flu and COVID-19. Remember, consult your healthcare provider for personalized medical advice. Rely on trusted sources of information. Stay informed about vaccination recommendations. Practice preventive measures diligently. Seek prompt medical attention when necessary. By staying informed and adopting a proactive approach to our health, we can navigate the challenges posed by infectious diseases and protect ourselves and our communities. Section 10. Conclusion: your health, your priority. The journey towards a healthier future begins with understanding the intricacies of our bodies and the threats posed by infectious diseases. By recognizing the differences between flu and COVID-19, we empower ourselves to make informed decisions that safeguard our well-being and that of our loved ones. Remember, your health is your priority. Stay informed, stay vigilant, and seek appropriate medical care when needed. Together, we can navigate the complexities of infectious diseases and create a healthier future for all.